of microorganisms on your skin. La Roche-Posay Double Repair Moisturizer Prebiotic Skincare to restore healthy looking skin and provide long-lasting 48-hour hydration. Recommended by over 90,000 dermatologists worldwide. La Roche-Posay. Recording. There we go. Thank you so much for taking out the time going over our sexual health course, the basics and beyond. We're promoting sexual health, the basics and beyond. We will begin promptly because it is so much information to go over. We are starting this evening on Unit 5, the sexual response. Any questions or concerns before we begin?
I had a question when I was reading over the last week's section. It was talking about how you should use like lubricants and stuff, and one of them they said like if you're with your partner or whatever, you should always use a silicone-based lubricant because they're the ones that don't wear out. But it contradicts itself because it says you're supposed to be using like a water-based lubricant or it'll break down a condom. So are you just supposed to pick and choose your battles, or should it be water-based or should it be silicone-based? Like which one?
So that is an excellent question. I did find that information unique myself. So this is the thing, as consultants, as we are promoting products or encouraging someone to get things, it depends on what they're doing. If they need to use a contraceptive and they may be using condoms that are latex, they cannot use a silicone-based product. For that alone will defeat the purpose. It makes the latex not so effective, right? So then that's a choice of theirs, but they do need to be informed that, hey, however you might be trying to do some water play and some other things, there's a conflict there. You might not be able to get in a jacuzzi, use a latex condom and have on pure pleasure silicone-based lubricant. You understand? But it doesn't mean that they don't use lube. They're just going to have to decide what they're doing.
So it's just our job to inform them of both of their options and the pros and the cons to both.
Yes. So they might opt to not do water play. You know what I mean? I don't know the data on using a latex condom in a jacuzzi, how effective that is alone. So there could be a conflict both ways. You know what I mean? But that's not one of our products or something that I've already researched, so I wouldn't be able to say. But there could be a problem with the chlorine in the pool. I mean, the chlorine in the jacuzzi, if they're not using a private one and using different type of cleaners and different things like that, sanitizers. So all of those things can affect products that you use. So shower is one thing, or bathtub is one thing, and jacuzzi with chlorine could be a whole nother issue.
Okay.
But definitely informing them which ones are good for what things. Okay. So in going through the models of sexual response, I'm going to, of course, abbreviate some of what we visit, and I don't think I screen shared yet, right? Okay, so let's get that screen pulled up. I thought I did. So let's share the screen. And that was a great observation, you know? That was that active listening. So what we view as romantic, go ahead.
Use condoms.
Say that again.
I was wondering because I'm like, wait, it's like you're supposed to use protection, but they say protection like does not work with your lubricant. I was so confused. I'm like, so we got to make a choice now?
No, they're going to just use a water-based lubricant, which, you know, we have those. We have those.
Yeah, that came in my 99-day kit. So I was like, this is water-based.
Yeah.
So I guess that's the condom lube.
Yep. Yep. Okay. So in promoting Sexual health, models of sexual response is one of the key chapters. So what we view as romantic and erotic and how we experience arousing stimuli varies greatly from person to person. Each of us experiences pleasure in numerous ways and for perhaps unlimited reasons. So our individual capacity for pleasure is perhaps limited only by restrictions we create. As such, pleasure can be experienced on many levels, including physical, emotional, psychological, spiritual, and perhaps relational. So in short, that is saying that we all have different pleasure ranges. Like if there was a gauge or a scale or a range, we don't all experience it the same and for the same reasons. Okay. So what we're going to begin to review is the research that was done on the sexual response. Okay. So the first one they talk about is by they call it the Masters and Johnson's model of human sexual response. Okay. And that's still in this first section. So William Master and Virginia Johnson developed the 4-phase model of sexual response that includes excitement, plateau, orgasm, and resolution. Okay. Now, their model demonstrated a difference between male and female responses. So that was the focus on that particular research and that 4-phase model. So the model is based on their work, providing therapy to couples using a behavioral framework. So a common criticism in this model is that it was developed based on work with women. I'm sorry, it's better for me to read it a little bit from here. Work with women who could not only experience orgasm fairly reliably, but who could do so in a laboratory setting. So it's kind of like their research was done on people who could orgasm easily. It didn't matter where they were, and that it happens frequently for them. So some sexuality researchers have suggested whether there might be differences in sexual response model for women who are less likely to orgasm or who do not experience orgasm. So for example, do these women spend a longer amount of time in the excitement phase? So with one, so the model, okay, so with one phase always happening before the next, which is not necessarily how sexual response always works. So what happens to arousal and excitement if and when a woman doesn't orgasm? They still get excited, right? Masters and Johnson's model, although still widely used, ignored psychological and motivational factors. So again, this is research being done. Masters and Johnson is dated 1966, and their model is widely used, even though it has some flaws. Okay. When you have your own personal experience, you might say, okay, I don't fit in that category. And they say, okay, however, we found that some people do, but it is not covering all the psychological aspects. Okay. So then we go into another research, and this is by Helen Singer Kaplan. Okay, so at the end of the 1970s, this pioneering sex therapist, author Helen Singer Kaplan, suggested that based on her experience as a therapist, sexual difficulties fell into 3 categories. There was desire, excitement, and orgasm. Okay. So by including the desire phase in this model, Kaplan presented a unique perspective of including non-genital changes in the sexual response. So for many women, even more men, spontaneous sexual desire does not proceed and cause sexual interactions. So in this common experience, sexual desire increases after sexual interactions have begun. So they may not have noticed that they didn't feel like having sex But once they did, they actually started feeling desire for their partner. This is a feedback loop that is often experienced by both men and women. So this model is similar to Masters and Johnson's model in that it is linear, but it does not take into account relationship or contextual factors and remains very orgasm oriented. So now they're kind of comparing the two researches, the Johnson, Masters and Johnson model versus the Kaplan model. So Kaplan added the desire in and said, hey, sometimes men and women both don't feel like they have the desire to go through sexual activity, but once they get involved, they're okay. So you don't have to have those components that that the Johnson and them said that you needed in order to have sexual intercourse. So they're just comparing notes and people's experiences, okay? So we get to the Rosemary Bason's model. So a more contemporary model for sexual response have been provided by Rosemary Bason in 2001. And I don't know if I'm saying her name right, forgive me. This model focuses on cycles and recognizes that people engage in sexual interactions for reasons beyond sexual hunger or desire. So the main idea is that various cycles within the mind, as well as between the mind and the body, are interacting throughout a sexual experience. Sexual interaction with a partner can enhance emotional closeness and influence arousal. So this model provides the beneficial separation of psychological sexual response from subjective arousal or the perception of feeling turned on. So this fits with the experience of about 1/3 of women in the sample in the study by Sand and Fisher in 2007. So and with that one, they rarely sense innate sexual hunger. However, those women who were more likely to endorse this model of sexual response had more poorly adjusted sexual functioning than women who endorsed one of the other two models we discussed above. So that is a lot.
What do they mean by endorse?
So those other two models that were pretty much put on the floor as they're called models, meaning that this is how people function. So they had model 1, and then now they have model 2, and now we're on model 3. So they were endorsed or set forth as a standard. Okay. So they're like endorsed or being claimed as standard models. Okay. They're endorsed by the norm of society and American culture. This is how people function. So let's go into the brain and the sexual response, okay? So it is well established that the brain and the body are not separate entities when it comes to sexual response. They interact as we respond in sexual ways. However, they may react differently for men and women. So Chivers and colleagues in 2010 found that men tend to have a greater deal of agreement between their thoughts and their psychological response than women did. So with men, they can see that they are aroused, but with women, it isn't visible, or maybe as visible, right? Regardless of whether it is recognized or not, the brain plays a stronger role in sexual response. So we're going to go into one of the systems called the limbic system. So this is the region of the brain associated with emotion and motivation. And it is important to the sexual function, okay? Specifically, parts of the hypothalamus are associated with sexual arousal and behavior. So there are chemicals in our brain called neurotransmitters, and they influence the sexual arousal and response as well. So we have dopamine, which is one that excites and can facilitate sexual arousal, whereas we have serotonin, which is a substance that appears to reduce or inhibit sexual arousal. And then you have oxytocin, which is a hormone produced here that increases throughout the sexual response and may have a bonding effect on partners. So I'm not sure if any of you have heard about those neurotransmitters that we just talked about, but they're very, very key in this whole process. And
I have a question.
Mm-hmm.
Is oxytocin the one that they refer to as the cuddle hormone half the time, or is that a different one?
Is referred to as the what?
I've heard that like oxytocin is supposed to be called like the cuddle hormone, or is that one that's like it?
I have heard some things like that, but because I'm in a study session with you guys and I am not a physician, I'm kind of on the same level as far as studying. I am not going to claim all the facts on that one.
I have a question.
Sure.
I'm on my phone on the Zoom, and
Mhm.
you're reading, but is mine the only one stuck on where it says, like in the beginning of the brain and sexual response?
So
Okay.
right, I didn't move it up. There we go. There's the limbic system. Okay. Sorry about that.
Yeah, I was.
Y'all gotta let me know. Let me know.
I didn't want to interrupt, so I was trying to wait for
Okay.
a good time.
You know what, just so you know, I'm working with, I also have this here, but I didn't know how to highlight this particular text. So I have my printed version that has certain section highlighted so that I make sure I don't read the whole chapter, because then we'll never get finished, right? So sometimes I'm reading from what I have highlighted, even though it is the same text.
Okay.
Okay, but I got it. I'll make sure I got it up here, okay?
Thank you.
Absolutely. Okay, so but Jasmine, to what you were saying, that in part where it says throughout, it increases the oxytocin, increases throughout sexual response and may have a bonding effect on partners. It sounds exactly like what you were talking about.
Okay.
Okay. So before, during, and after sexual interactions, the body is providing feedback to the mind. Okay. A positive experience in these areas makes them positive sexual stimuli, and a negative experience can make these factors a negative stimuli for a response. So it depends on each person's background, if they've had any trauma, if they've had really good experiences. This is going to determine what is triggered. Okay, they're a point of reference. So here's an example. Yeah. So for example, the sight of a partner's genitals may produce positive feelings and enhance arousal, or negative reactions that may inhibit a sexual response. This is because we carry with us memories of past sexual interactions. We also carry the connections made in our mind about these stimuli and how they have worked for us or not in the past. These memories, as well as our values and feelings about what is right or wrong, what is attractive or unattractive, or sexy or not, can influence how we translate the stimuli now and in the future. So can you all relate to how different everyone's experience could be based on what they have going on up here?
Yeah.
Yep. And so we have to remember that also, even when we're sharing products, experiences, and things like that. Again, we want to keep everything kind of inclusive. We don't want anyone to feel bad, because maybe that's not what they're experiencing. Okay. So here we go. Of course, our 5 senses play a very big role in our sexual response. So first, touch. Touch is and fulfills one of our most basic and sexual needs. So, and we'll go over them again, but I'll just go ahead. Primary erogenous zones. I think we talked about erogenous zones in the previous chapters. Yeah. We talked about those. So those are the body parts with the highest concentration of nerve endings. And then we have the secondary erogenous zones, and those are the ones that a person may find pleasurable to be touched, but they're just your secondary ones. So let's go to sight. Sight can influence sexual response too, as evidenced by popularity of commercial erotic materials such as porn. So culturally, men are encouraged to enjoy and use visual erotica more than women. However, visuals have an impact.
Is that why women
Yes.
read so many books?
Yeah, sometimes we love a lot of those books and different stuff like that, and then they might be looking at porn, but we might be reading. But there's no thing to say
That's
that
a
women.
better plot.
Yeah, it's not to say though that women don't watch porn or don't enjoy porn. It's just as America has started to standardize things, a lot of the research is a little old, if you, in my opinion, but they have a little bias on some of the things. And as we are more diverse with gender stuff, then you'll find out that it's not just men or just women with a lot of things. They just didn't do a good job being inclusive and diverse in the whole process. So we're gonna go to taste. Taste is an aspect of sexual interaction that can enliven the experience. We know that because we sell all the flavored goodies, right? Sexual enhancement products such as flavored lubricants or massage products often incorporate familiar flavors such as strawberry, chocolate, raspberry, or mint. So people also use food or other products that influence the taste of one's own or a partner's body parts. Many people list oral hygiene as an essential aspect of attractiveness in a partner. For example, concerns about taste and a partner's reaction to one's taste are common when kissing and giving or receiving oral sex. Hold on. All right, and everyone, if you can mute unless you're speaking, because it is open forum. It's not meant for you to not speak, but we want to keep the background noise down because we'll also have people listening to the recordings. Okay, so we're going to go to smell. Smell is a sense that can best trigger a memory, and as such plays an important role in sexual response. People vary in what smells they prefer during sexual interactions. Natural body odors may be appealing to some, while others may prefer a more deodorized or perfumed experience. Okay. There we go. Okay, so sound and its importance to sexual response can also vary widely from person to person and from interaction to interaction. Language used as noise made before, during, and after sexual interactions are highly individualized and situational. So it depends on you, what you like to hear, okay? All senses can both enhance or inhibit the sexual experience, depending on individuals' preferences. Now, there is a great deal of variation both between women and men within each gender, but from individual to individual. Also, this emphasizes that importance of getting to know preferences of a partner through communication. Communication is always really, really key with the whole process. What do you like? What don't you like? If you didn't know before and you find out, please tell the other person. It helps. All of the senses, So let's move to the next one. Fantasy. Fantasy is another way that the mind is connected to sexual response. A romantic and erotic idea. They are very popular way to enhance your sexual response and may play a role at all stages of the response cycle. So fantasy is actually a very common suggested technique in couples therapy for treatment of issues concerning desire, arousal, and orgasm. So that is recommended treatment. So the next section. Okay, how are we doing? Okay. We're going to go to the individual nature of sexual response. Those who have worked in a therapeutic role with people who have sexual difficulties and concerns note that there are wide variations in what people respond to sexually. For some individual body parts are especially arousing, and there are a number of objects that some people find arousing, including sexual enhancement products, costumes, accessories such as high-heeled shoes or stockings, among many others. So sexual response is complex and fluid across the lifespan. So there's rich diversity in how each individual experiences sexual response and our sexuality. Our cultural heritage and community of affiliation can have an impact on our acceptance of how appropriate some aspects of sexuality may be. For example, individuals whose religious community condemns same sexual behaviors, feelings of desire and excitement for the same-sex partner may evoke feelings of shame and guilt and be denied or buried. On the other hand, those who were raised to believe that sexuality is a lifelong process and is natural, beautiful, or loving. Okay, hold on. So there are other ways that understandings of sex and context in which we live are improving too. For example, the Women of Color Sexual Health Network has actively been creating more conversations about the intersections of women's sexual lives. So there's some book references here. There's book, I don't know if you've seen in the chapter when you were scrolling through, Curvy Girl Sex by L. Chase, and several books about aging in sex, one by Joan Price. There's Naked at Our Age, The Ultimate Guide to Sex After 50, that offer expanded views of sexuality and enjoyment. All right. So we're going to move on to section 4, where it talks a little bit more about the sexual response cycles. So despite its flaws, Masters and Johnson's model of sexual response is still the most commonly used response model and is currently used for diagnostic purposes when diagnosing sexual problems. Okay. So remember we went over those 3 researchers? Well, it's definitely saying that Masters and Johnson's model is the one that's most widely used when professionals are diagnosing someone's sexual problems. So they do know.
They got a show.
What'd you say?
I said that's probably why they're the ones that got the show.
Okay, right. So excitement. So nipples become erect, breath quickens, and skin may become flushed. Blood flows to the penis or clitoris, engorging and enlarging it. This is a process called vasocongestion. So a woman's vagina will begin to lubricate, though vaginal dryness and difficulty with lubrication is more common as women age and reach menopause. But during excitement, contractions around a woman's uterus can lift the uterus upward, making more space in the vagina in terms of length and width. And this can make vaginal intercourse a vaginal sex toy. This can make vaginal intercourse or vaginal sex toy play more comfortable and pleasurable for women. Plateau. This is that heart rate. So they're going over these different stages in the diagram. So if you don't mind, I'm gonna have the diagram up as I finish describing the other stage. So we just read excitement. And so the next one is plateau. So you just watch the diagram, okay? The heart rate, blood pressure, and breathing and muscle tensions all increase. Testicles draw closer to the body, and a man approaches the point of ejaculatory inevitability. For women, vaginal lubrication increases, and the labia and vaginal opening darken in color, thanks to the increased blood flow to the genitals. Orgasm. Nipples are erect, heart speeds up. There's a flush across the chest and genitals. The anus contracts and the body muscles tense. So that one is the orgasmic step. And then you have resolution. Following orgasm, blood flows away from the genitals and the heart rate and blood pressure decrease. The testicles drop and the penis is no longer erect. Research suggests that most men require a resting period of at least 20 minutes and longer for older men. Before psychological arousal, erections will occur again. Very young men, teenagers and men in their 20s, for example, may find that they can have erections again soon after ejaculation. Some women experience extra sensitivity in their clitoris after orgasms due to extreme engorgement and draining that has occurred. So we went through those stages. So variations and challenges to that sexual response. This is part one. So as is suggested by the Basin model for sexual response, there's a complex interplay of mind and body experiences. So one approach to deciding if a sexual dissatisfaction is a problem is to know if it has caused a problem for the individual's life or relationships, rather than relying on the normal sexual response cycle, meaning going through the excitement, plateau, orgasm, resolution. So if you look at that diagram that we went over on the previous page, some may say, well, I had a great experience, but I didn't go through all 4 of those stages. But it doesn't mean that you didn't have a enjoyable or pleasurable time. So given this approach, 2 people can be experiencing the exact same situation, and it may or may not be a problem for either or both. So this is illustrated by a study conducted in 1999 by Lawman and colleagues that indicated that as in one sample, 43% of women reported having problems with desire, arousal, and orgasm, yet only 12% of those women reported being personally distressed by the problem. So that is to say that problems aren't always problems. When it is desirable to create some change, it is helpful to remember that variations and challenges can result from many factors and can be addressed in numbers of ways. So one very common complaint among couples is the imbalance of sexual desire between partners, sometimes called a desire discrepancy. So evaluating sexual problems through discrepancies in a couple has advantages over traditional diagnostic systems that do not take the couple into consideration. So what is normal for you and your partner? Okay.
What is discrepancy?
discrepancies, like differences, like you don't agree?
Thank you.
Mm-hmm. So, however, if the couple had high overall sexual satisfaction, regardless of the discrepant levels of desire, the relationship satisfaction remained intact. So if you both enjoyed, then you both enjoyed. You know, that's what that means. You know, there are some stages and steps to the arousal process, and it's kind of like a guide that'll help you understand what's going on. However, we're not cut one and the same. We're all unique, we're all different, and they're trying to bring that connection between your past references, what's in your mind, all the senses that come into play during sexual interaction or arousal process. All these things make it more complicated to just put us all under one blanket and say, this is how this person is going to be aroused, or this is what's going to make it pleasurable for them. So they're giving us a guide, and everybody doesn't fall under that same banner. So I don't want you to get overwhelmed. It is a lot of terms and a lot of research being shared, and it is so that you have a full rounded perspective of what's going on and where the information came from. So it is sometimes said that when one person wants sex more often than another person, it is the one with the lower sex drive who decides when they have sex. This may be an overstatement. Remember that sexual arousal is one of the several reasons that people engage in sexual interactions. So open communication, negotiation, exploring sex play beyond intercourse can help to distress libido tension in a relationship. So we also sell products that can kind of help with that. The Hello Libido, the Basic Instinct, things like that can help that one person who has, you know, a less of a drive. And maybe it's because they haven't really activated those different things that are triggers for them. So, you know, if the kids are running around the house and a lot is going on in their head, maybe they have a highly stressful job, they're not going to be the one all the time who has the higher sex drive and can just turn on and off. So it doesn't always indicate that there's a major problem, but communication is the first way to discuss it. You know, you can talk to your partner and say, listen, please don't touch me when the baby's holding on my leg and screaming, and, you know, the dog is barking and whichever. And then they could say, oh, okay, that's like a turn off for me. You're trying to cuddle up and I'm trying to get everything settled. So one person could be like, oh, you love me through all of this, and they can enjoy it. And someone else could say, it's just such a turn off. It makes me have an attitude. So communication is really, really good with all of these things. So even if you're helping a client with some stuff, you know, we're not therapists, but you can also still offer and say, hey, it might be good for you guys to talk to a therapist. Those kind of things help bring the connectivity there. So staying on task. Okay, however, in a study by Fisherman in 2004, researchers found that sexual desire problems are most commonly reported sexual problem in women. Sexual enhancement products and masturbation can be helpful in addressing situations where only one person in a couple is in the mood for sex. So we just kind of talked about that. It's important to communicate and affirm feelings of attraction and connection to the partner when sexual interactions decline. So otherwise, when a confident lover may feel inadequate or unattractive to their partner, however, the key skill of learning to accept and sometimes decline affection or sexual activity, it is very important for couples to develop so that both partners feel free to act only in ways that feel right to them rather than giving into sex that they don't want. So it can go both ways. It could really cause some problems if the other partner keeps feeling really rejected, and it could just draw the wedge more instead of them coming closer together because the communication isn't there, and them kind of working through that. Almost there. So let's do the variations and challenges of sexual response, part 2. Okay, so it's also important to note that one's level of sexual desire varies from lifespan. Most of these are not diagnosable problems. In fact, quite often people experience lower levels of desire because of common everyday life stressors such as having had a baby, feeling overworked, not having enough sleep, or feeling sick. Who can relate to that? Those are easy, right? Easy, common ways. It doesn't mean you have any problems with your body per se. You know what I mean? This doesn't mean you have an underlying concern or you need medication. This is called life. But it's important to acknowledge that sometimes sexual problems are an appropriate response to a particular situation. So if the emotional closeness isn't present for some people, it may be natural for sexual response to struggle, okay? Some challenges to sexual desire that create dissatisfaction for individuals include, so these are some terms that you might want to put in your little glossary or vocab, but hypoactive sexual desire, that's the absence or desire or minimal desire or response prior to or during sexual interactions, okay? Hypoactive. The next one, sexual aversion, actively avoiding sexual interactions. And then we have hyperactive sexual desire, a persistent desire for sex that is difficult to satiate. There may be another term for that, but it's okay. So these are some stages of challenges to sexual desire, okay? So these types of sexual problems are best diagnosed and addressed by a professionally trained counselor or therapist. Let us stay in our lane. Let us try not to be that person, okay? If women who you are working with seem to experience ongoing problems with sexual desire, you might suggest that they meet with a therapist. That is easy. It is okay to not have all the answers for them. And then there's just a link there, just different ways. If someone's like, well, where do I find a sex therapist at? We're supposed to know where to find that information. So this is something that you might want to bookmark somewhere or have as a reference guide. But you do want to know where they can find it, because I'm sure there's like a search and you can put in your zip code and everything. And just like we find doctors, nurses, and things in our area, that's the best way. Okay. So sexual arousal can be a source of dissatisfaction for both men and women. Among known challenges are female sexual arousal disorder, meaning the difficulty or inability attaining adequate lubrication and genital swelling, and or difficulty or inability to feel sexually aroused. So in a previous chapter, we talked about those stages of arousal. It starts first in our mind, and then we have to have, women a lot of times have to have that skin to skin contact, where men, they don't have to have skin to skin contact to be aroused, and increase blood flow. No. But that increased blood flow sometimes may not be happening for someone else. So that is a disorder. That means they might be going through the motions to bring about that arousal and that blood flow, but it's not happening. Okay. So persistent genital arousal disorder, meaning genital and breast vasocongestion and sensitivity, persisting for hours or days, that is resolved only temporarily following orgasm and is not associated with desire or excitement. Wow. Persistent genital arousal disorder. That one's a new one for me. So this is good information. I had never heard of that. So it's pretty much the opposite of the first one. The male erectile disorder, difficulty or inability to maintain an adequate erection for desire or sufficient for a sufficient length of time. Hold on 1 second. We're almost ready for that. Oh, we got one more chapter, one more section. Shoot, I keep trying to keep time. It's a lot to cram. Okay. So we're going to go into some orgasmic disorders that are among those that challenge one's sexual response, okay? So there's problematic timing of ejaculation. Ejaculation happens either too early or is delayed or absent. Then you have female orgasmic disorder. A woman's orgasm is substantially delayed or absent. It just doesn't happen. Then you have primary and secondary orgasmic disorder. Primary orgasmic disorder refers to having never experienced an orgasm, while secondary orgasmic disorder refers to a cessation in one's ability to achieve an orgasm after a period of experiencing at least one prior orgasm. All right. So we have another one, sexual pain problems. These can occur in both men and women. Both tend to be more common in women. Pain problems may interfere with any aspect of the sexual response cycle and can be distressing for all members involved. Sexual pain problems include, I think I'm saying it right, dyspareunia, recurrent and persistent genital pain associated with sexual intercourse in either male or female. Vaginismus, within women, recurrent and persistent involuntary spasm of the musculature of the outer third of the vagina that interferes with sexual intercourse. And I didn't look this one up, y'all. I don't know what to say.
Vaginismus.
Yeah, the next one, and non-dyspareunia.
Holiday.
Pain occurring during anal intercourse. So a number of physical and psychological factors can contribute to sexual pain. If a woman or man you work with brings up sexual pain problems, the first step is usually a physical or medical exam with a physician who has specialized training in sexual pain. So pretty much there could be some other underlying issues that we are not trained to assist with, unless you are a medical professional. Okay, lifestyle influences on sexual response. As in this case, with most other aspects of our bodies and our health, one's lifestyle has an important influence on one's sexual response. Stress, whether from work, caring for loved ones, or with a romantic relationship, can have tremendous impact on sexual response. Alternately, a healthy sexuality can also help to reduce stress. Healthy sexuality can also help reduce stress. Overall health, which is greatly influenced by general lifestyle, is central to sexual interactions and sexual response. If a person is ill and feeling very tired, they are unlikely to have the energy for sex. If they are in pain, they are less likely to desire sex. Mental health conditions, such as depression, can impair sexual desire, ease of orgasm, and other aspects of sexual response. This is very, very key. I'm a big advocate dealing with mental health, and these are very, very common things that could cause someone not to have the same traditional norms. As we've already seen, different people have different experiences. So it's very, very important, even in our language and our approach, to be very inclusive, not to offend someone. Medications and health treatments can inhibit sexual response. For example, some medications can make it more difficult for men or women to orgasm. Others contribute to low sexual desire or cause ejaculatory pain. Additionally, it is often difficult to untangle whether the side effects of medication are a cause of a sexual problem or the actual problem the medication is treating are the causes of the sexual problem. Is it the medication or what you're taking the medication for? So being significantly overweight or obese, in addition to complexities, creates an overall health and well-being, can impact physical abilities for some sexual positions and experiences, and contribute to challenges in sexual response due to impact of self-esteem, confidence, and feelings about desirability. This is really, really major. I want to just share that I'm finding this very common. You wouldn't necessarily call someone out and be like, oh, well, you don't like how you look, or, you know, it's still your approach. But if you're an active listener, listen to your clients. And sometimes people who do have, you know, a problem with the way their appearance, it carries over into relationship. It carries over into how much they love themselves, their ability to just be comfortable in their own skin. So self-esteem and confidence will affect your sexuality. And we can use that as a note to self. Being significantly underweight can also impair a person's sexual response, especially if they have low body fat and that their hormonal production has been disrupted. Performance anxiety about one's ability or concerns about how one looks in the interaction can lead to spectatoring or psychologically removing yourself from the interaction in order to watch yourself in the interaction and judge your performance or appearance. Okay, so they're not so much in the moment, they're trying to watch the video while it's playing of themselves. That can make you really disengage when your partner's trying to connect with you. Smoking and the use of alcohol and other drugs can initially decrease inhibitions, but ultimately can have more negative impacts on sexual responses, including desire, arousal, and orgasm. Okay, thought we had a question there. We good?
Yeah, I think it might have been me that accidentally pressed unmute.
Okay. All right. We are going to go ahead to the unit quiz because it is almost time to start the next section. And I know some of us may be trying to get on the EEO opportunities this evening as well. Hopefully you all getting some new leads. If you are able to follow along and take your quiz, please do. You got this. We're here with you, okay? If not, please get on soon after. It helps you to go ahead and complete the quiz and get it out the way, opposed to kind of putting it off and losing some of the content. If it's fresh on your brain, you can go ahead and get that out the way. It is required that you go through each learning unit and complete the quiz in order to certify for this course. Again, there's the 14 units, and by the 21st, we'll be done. We'll all be done. You can get done sooner, but we'll all be done, right? That's the goal. All right. So question 1 for unit 5. All 5 senses play a role in sexual response. True or false?
True.
Yes, feel free to unmute. I want to know that you all are with me. Okay, question 2. It is important to compare your sexual response to the sexual response cycles rather than your partner. Who should you compare your sexual response to? Your partner or what they say is the norm?
Your partner.
Your partner.
Yes, thank you. Your partner say, oh, it was great. And you say, no, we didn't do all the steps.
Problem, it isn't one.
Right. Sometimes, oh, go ahead.
Problem.
Right, no problem.
If y'all don't see a problem, there's a problem.
Yes. All right. Sometimes sexual problems are a natural reaction to a particular situation. We
True.
talked about those factors: stress, normal everyday life. It could create a problem for you, right? Okay.
True.
All right. Compared to Masters and Johnson's model of the sexual response cycle, what addition did Helen Singer Kaplan contribute? Did she contribute arousal, desire, orgasm, or excitement?
Desire.
Desire.
She did add desire, yes. Okay. Basin's model for sexual response differs from Masters and Johnson's sexual response model. In what ways? Is it Masters and Johnson's model focuses on emotional closeness, whereas Basin's model focuses on physical aspects of arousal? Is it Basin's models have 4 distinct stages: excitement, plateau, orgasm, and resolution, whereas Masters and Johnson's model is more, how do you say that word, y'all?
Cyclic.
Cyclic? Okay. Oh, like cyclic. Okay. Masters and Johnson's model includes desire, excitement, and orgasm, whereas Basin's model leaves off desire? Or is it Basin's model enforces the idea that various cycles within the mind and between the mind and the body are interacting throughout a sexual experience, whereas Masters and Johnson's model focuses on the physical aspects of sexual response?
That one.
That one, right? Yes. So Basin's model enforces the idea that various cycles within the mind and between the mind and the body are interacting throughout a sexual experience. And Masters and Johnson's model focuses on the physical aspects of sexual response. Perfect. Areas of the body that often feel good when they are touched sexually and play a role in sexual response are called
Androgynous zones.
erogenous zones.
Erogenous.
Very good. And the options were erogenous zones, pleasure zones, feel-good zones, or none of the above. And we know that erogenous zones is the one. Number 7.
Slang term.
This is the system of the brain that is associated with emotion and motivation and important in sexual function. Is it the frontal lobe, temporal lobe, limbic system, or executive function?
Limbic system.
Limbic system.
Absolutely, limbic system. And it has a lot of details to it, right? Those sexual transmitters. These researchers were the first to scientifically introduce women and men as sexual beings in the context of pleasure. Was it Kaplan, Masters and Johnson, Kinsey and colleagues, or Basin?
Masters and Johnson.
Kinsey and colleagues.
Kinsey and colleagues, yes. All right, 9. The experience of sexual response includes relationship context, psychological response, cultural context, or all the above?
All of the
All the above.
All the above. Yes. Number 10, primary orgasmic disorder refers to what? Is it the cessation in one's ability to achieve an orgasm after a period of experiencing at least one prior orgasm? Is it having never experienced an orgasm? Or a woman is substantially delayed or absent, or none of the above?
a woman's
D.
orgasm.
A woman's orgasm is
So there was primary and secondary orgasmic disorders. And
okay.
so the primary is having never experienced an orgasm.
Okay. What a horrible disease.
Okay. 11, despite its flaws, most commonly used cycle of sexual response. Who was that? Was it Masters and Johnson, Kaplan, Basin, or Tiffer?
Master and Johnson's.
Masters and Johnson's. That is correct. Okay, and we are on 12. Desire discrepancy refers to what? Unequal levels of desire to the norm that is outlined in the sexual response cycle. Different levels is desire compared to a current partner, changing levels
That
of
one.
desire over lifespan, or lack of sexual desire.
E.
Yep, just different levels of desire compared to your current partner. So that can change. Desire discrepancies. We got discrepancy. We don't agree. And 13, hypoactive sexual desire is best treated by what? A magazine that discusses how to spice up a sex life, by a physician, a trained counselor or therapist that specializes in sexuality issues, a friend or family member. Of
A
course.
counselor or a therapist.
Yeah, we want to stick with the professionals, right? Especially for the hypoactive, right? Male erectile disorder refers to 14. Is it difficult or inability to maintain an adequate erection for desired or sufficient length of time? Inability to orgasm, inability to ejaculate, lack of desire for an appropriate erection or response. Which one do we have?
The first one.
A.
Yes, also known as ED, right?
Yeah.
Erectile disorder, erectile dysfunction. A lot of times you might hear people use the term ED. 15, when blood flows to the clitoris and labia, engorging and enlarging them. It is called what? Is it resolution, vasocongestion, dilation, or all the above?
Vasocongestion.
Yes.
Dilation.
All right, let's see what we got. Number 1, true, that is correct. Number 2, false, correct. Number 3, true, that is correct. Number 4, desire is correct. Number 5, Basin's model enforces the idea. That is correct. 6, erogenous zones, correct. 7, limbic system, correct. 8, Kinsey and colleagues, correct. 9, all the above, correct. Number 10, having never experienced an orgasm, correct. 11, Masters and Johnson's, correct. 12, different levels of desire compared to a current partner, correct. 13, hypoactive sexual desires. Oh, I'm reading a question and not the answer. A trained counselor or therapist that specializes in sexuality issues, correct. 14, difficulty or inability to maintain an adequate erection for a desired sufficient length of time, correct. 15, vasocongestion, correct. 15 out of 15. Ding, 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 ding. We got it.
What's the highest score that you can get in order to pass?
If I'm not mistaken, if anybody can help me, I thought it said 80% and above. We're supposed to get 80% and above. Uh-oh. I have to go back through. I can look back. I'm not sure, but I think you're supposed to get 80% and above. But when I first read the instructions, it was a minute ago. But I can take a look later and I can post it in the chat.
Okay, I'm just going by like how many I guess incorrectly. So I'm guessing I probably wouldn't have passed this one, but I got most of them.
Well, this is why we're having a study session, because you don't have to get any wrong. All righty.
I gotta add it to my list of YouTube videos on top of the ones you already.
Right. Oh, well, do what you can. We're here to support you.
What time is that EOO supposed to go on?
It is going to be 9 p.m. Eastern time, and we will get off of here, finished or not. No, we're gonna finish and get out of here. So it's
all right, because usually everything happens at 7. That's why I was like, what time?
Yeah, it's 8 Central time. So it's in shortly, right? What time is it?
It'll be fine.
Yeah, an hour. We got less than an hour. Okay, what is sexual orientation? Sexual orientation refers to enduring patterns of emotional, romantic, and/or sexual attraction towards women, men, and people of more than one gender, or to no one at all. Sexual orientation and sexual identity are used to mean many things. We use the terms to refer to the way people classify themselves sexually, such as heterosexual, straight, gay, lesbian, bisexual, or asexual. A person's sexual behavior and sexual desires may or may not be considered by or others to be consistent with their self-identified sexual identity and orientation. Everyone has a sexual orientation. Specifically, sexual orientation refers to the directions of your feelings of romantic and erotic attraction. So generally, when we speak of the direction of one's sexual orientation, we are speaking of making distinctions between people being attracted to people of their same sex, homosexuality, being gay or lesbian, attracted to people of the other sex, heterosexuality, being straight, or attracted to people of more than one gender, bisexuality or pansexuality. Okay, so those terms to help guide you through this section so that you'll know what's being referred to. Okay, so we got that orientation. We're going to go ahead into the second section. How common is it for people to identify as gay, lesbian, or bisexual? So many people are curious about how common it is for men or women to identify as gay, lesbian, or bisexual. And there has been much debate about this, not only within society at large, but also within the field of sexuality research. So for several reasons, it is difficult to describe within the population how frequently people are the various how frequently people are the various sexual orientations, meaning gay, lesbian, heterosexual, bisexual, or asexual. Factors that decrease the confidence in statistics about sexual orientation include inconsistency in how research questions are asked, the diversity of contexts in which sexual behaviors take place, excuse me, the fluid nature of sexual expression and orientation throughout your life, and cultural and personal attitudes and beliefs about sexual orientation. So most studies indicate that approximately 5 to 7% of Americans identify as non-heterosexual in terms of their identified sexuality. However, larger portions of Americans may have sexual desires or fantasies about people of their same sex, or may have engaged in sexual behavior with people of their same sex. Again, just because a person identifies as a certain sexual orientation does not mean that we can tell whether their sexual behaviors are alike. So research across cultures also shown that substantial numbers of men and women experience sexual activity with both genders during their lifetime, regardless of their self-identified sexuality. Differences exist across the studies in terms of the time frame in which the sexual behavior was measured. Lifetime, past 12 months, and because many individuals who engage in bisexuality are particularly hidden, in large-scale empirical studies, behavioral bisexuality among men and women has been found to be between 0.7% to 5.8% in the general US population. So we're going to go to sexual identity. So we got through the orientation, common for people to pretty much be flexible no matter what they say their orientation is. And then now we're talking about sexual identity. Sometimes as a way to own our identity, and also as a way to help others identify us as we prefer, we embrace various labels for ourselves related to our sexual identity. Examples of labels people choose to describe their sexual identity might be partnered, bisexual, transgender, sexually active, female, queer, dyke, gay man, adult virgin, etc. The list goes on, and the language evolves over time. The language is sometimes loaded and can be based on political and other intended impacts. Sometimes labels are combined, as in monogamous heterosexual males. So many labels can be perceived as derogatory if spoken by one who does not wear the label for him or herself. For example, some gay men use the term fag or queen to refer to other gay men. However, the use of this word by others may be deemed as offensive. This is similar to how some women use the term bitch in an affectionate or friendly way with their other friends, but they may feel offended, hurt, or angry if a man were to use this term to refer to them or another woman. Good analogy, good example. Hold on. Okay, some of the elements of our sexual identity that we may or may not attach labels to that help describe and represent ourselves include sexual orientation, who we have romantic and erotic feelings for, gender identity, a spectrum richer than two choices, sexual behaviors, what we do and don't do alone and with others, relationship status and patterns, single, partnered, monogamous, polyamorous, married, divorced, or parent. Attitudes, values, and beliefs about these various aspects of sexual identity, which create the meaning and context. So the relationship of sexual behavior to sexual orientation. Our sexual behavior is not what defines our sexual orientation. Rather, it is our feelings of attraction and desires that indicate our orientation. And sometimes people engage in sexual behaviors that are not consistent with their feelings of attraction. This can be due to many reasons and is often related to negative feelings they perceive in themselves or others that are based on widespread and incorrect assumption that all people are meant to be attracted solely to people of the other sex. Some people may also engage in sexual behavior that is not consistent with their orientation based on the context in exchange for money and single sex settings such as jails, etc. So too often, in overt and subtle ways, heterosexuality is not just expected, it is preferred or given higher status or privilege in American culture. This is called coming from a heteronormative viewpoint or having heterosexist views. An example of heteronormative viewpoint would be to ask a woman about her husband or her boyfriend to assume, in other words, that she has a male sexual partner, when in fact she may have a female sexual partner to be attracted to women, even if she does not have a partner. To help people, to help more people feel included, you may try to teach about sex with a partner rather than sex with your husband or sex with your boyfriend when talking to a group. By using this language yourself, you will find that others will begin to follow suit. And this can help people feel included even beyond issues of sexual orientation, as some people may be having sex with a non-inclusive, exclusive, non-relationship partner, such as friends with benefit situation. So again, that terminology is really, really key for us to be careful in discussing things, because we can come off very offensive.
So basically, just assume nothing.
The language has to always be inclusive. You know, all the way down to nowadays, you know, used to call everything, you know, you would say when you get your mail delivered, that's the mailman. Now they're mail carriers. I mean, that's another way of being inclusive. You don't know if it's a man or woman or what they identify with. So you could say mail carriers and make sure that you're not offending someone. So yes, it makes you think a little more about being intentional with your language. And this isn't the first time language was brought up. So as you could see, it's being reiterated in more and more in depth. We can easily be very offensive and not inclusive, even though it's not intentional, but in the role that we're working in promoting sexual health, now it is very, very important for us to focus on it. Okay.
Mind the business.
Culture and sexual identity. So sex research Alfred Kinsey developed a scale or continuum to help people better understand the variations of sexual behaviors in which people participate. This set the stage for viewing sexual orientation on a continuum rather than merely viewing it as two choices, which is exclusively heterosexual or exclusively homosexual. Dr. Kinsey research involves interviews with thousands of men and women in the US, published first in sexual behavior in the human male, and then later in sexual behavior in the human female. It was documented that more people had engaged in same-sex sexual behaviors with far more frequency than had previously been acknowledged or understood. So that goes to my, remember I said my perspective was that the research just wasn't thorough enough. So in documentation, this variation in human sexual expression, Kinsey developed a widely respected model for conceptualizing sexual orientation. So you see the chart here. So he has the scale, and this is by the Kinsey Institute. We are going to keep moving through this section. However, take a look at the Kinsey developed a widely respected model for conceptualizing sexual orientation. The idea that we all have a range of what and whom we are attracted to has been elaborated on and expanded to be applied, not just to our feelings of erotic attractions or overt sexual behaviors, but to also include our fantasies, feelings of romantic love, and childhood experiences. All right, so we're moving on to the Klein's sexual orientation grid. Okay, so the Klein's sexual orientation grid is depicted below for each of the 7 categories, which is sexual attraction, sexual behavior, sexual fantasies, etc. A person can indicate whether they have had that experience, feeling, or behavior in the past, in their present life, and this is an interesting aspect of Dr. Klein's model in an ideal situation. So you see the grid. So they also define what past is, what present is, and what is ideal. And then you fill in the grid with these numbers based on your answers. The variables: sexual attraction, sexual behavior, sexual fantasies, emotional preference, social preference, lifestyle preference, sexual identity, political identity. So this is a really cool system that Klein came up with. We will not do these activities because we won't get finished, okay? But definitely great to research, maybe fill out and take a look at. We're gonna move on to section 7 of unit 6, heterosexism and homophobia. So heterosexism is the preference for heterosexuality over the other orientation possibilities. With this comes an assumption that everyone is or perhaps or should be heterosexual. Some people do not accept that others may have feelings or behaviors that are not exclusively for or with people of the other sex. This can be especially true for those whose ethnic, subculture, or religious faith espouse and condemnation for homosexuality and bisexuality. Homophobia is having extreme feelings about the unacceptability of homosexuality, an unrealistic fear of or hatred for people who are perceived to be gay, lesbian, bisexual, and can develop and lead to discrimination or even violence against others based on perceived sexual orientation. We rarely actually know the direction of others people's feelings of attraction. As such, homophobic behaviors are typically spring from an assumption about someone based on stereotypes held about sexual orientation. Biphobia refers to intolerance of and fears towards people perceived to be bisexual. So what can you do about homophobia and biphobia, transphobia, heterosexism? So regardless of your identity, we all share responsibilities to end homophobia, biphobia, and heterosexism. So I won't read all the way in depth, but I'm going to go through these bullet points because they're very, very key. Be non-judgmental. Use gender inclusive and non-heterosexist language. Assume that anyone can be gay, lesbian, bisexual, queer, two-spirited, transgendered, or heterosexual. Don't tease or harass others. Don't out people, which means don't disclose anyone's sexual identity or orientation. Don't think of LGBTQ or persons solely in terms of their sexual orientation. Don't engage in homophobic or biphobic jokes, comments, slurs, or their behavior. Educate yourself. Talk about sexual diversity. Remember that as an individual, sexual orientation involves more than sexual behavior. Don't force people to hide. Don't assume that LGBTQ and people are suffering. Got lost. Hold on. Okay. Recognize intersections and similarities of prejudice. Engage in inclusive practices. And that was it on the bullet points. There's a lot of key information here, and a section on heterosexism. Definitely great reads. Please continue to read if you haven't read it already, but we are going to move on to, go ahead.
So we're talking about homophobic and transphobic stuff. How would you address something like that if one of your party guests was like doing something like that? Like, besides like not engaging, like how would you respectfully kind of shut that down?
Okay, so one of the key things is setting the rules or etiquettes prior to your session. So you know how we also set the stage for no women, I mean, not no women, I'm sorry, no babies, no men, or no one under 18. Also reminding people to be mindful of others' preferences and keeping a positive, this is a safe environment. So you want to set the stage and let everybody know this is that safe place. You can I would always address someone who is not being very kind, because no matter whether it's a homophobic comment or anything like that, you don't want someone to make unkind comments at all, right? So you would address it in the same way and let them know kindly that it's not accepted. And if you're the hostess, if it's a virtual event, you can always remove that person at the time if it becomes very unhealthy, but you can usually kindly like remind someone of certain languages and kind of redirect it in a really positive way. But you would have to be skillful with it, but just being mindful that, yeah, it doesn't take over the whole vibe of your session. You know, if you let it get out of hand, it can do that. And then there's like the elephant in the room. So highly recommended to make sure you have like good control over the scenario. If something comes out that's not appropriate, identify it. you know, clear it up so everyone's good. And if it seems like it's something that could be an ongoing problem, you know, I would kindly ask someone to, you know, remove themselves, or I remove them from the session, and kind of keep it moving and address it later. But also talk with your sponsor, anyone, about some other things, because I've been in since August and there could be some other great wisdom.
Okay.
Bisexuality. So people who identify as bisexual sometimes experience stereotypical assumptions and discrimination about their orientation from both heterosexual and gay or lesbian identified individuals. A common misconception is that individuals who identify as bisexual are equally attracted to women and men. So the common ground, hold on, where are we? Okay, there we go. The common ground for bisexual individuals is that they are attracted to people of more than one gender. Some bisexual individuals identify as pansexual to emphasize that they are attracted to people of a wide range of genders, for example, including trans or non-binary individuals. Others identify as pansexual to communicate that in addition to being sexually attracted to people of more than one gender, they are also open to engaging in a broad range of sexual behaviors. So various issues are the basis of the stereotypes that do not support a bisexual identity, including thinking that bisexuality is a denial or confusion about being exclusively homosexual or heterosexual, a transition from heterosexual to homosexual or vice versa, an indication that she or he has multiple partners at the same time, or consistent throughout life with equal levels of attraction to men and women. So it's kind of like, don't get it twisted. Bisexual is just what it said. Sometimes, you know, identifying with more than one sex. So bisexuality is often misunderstood and mystified areas of sexuality, and many have mistaken the view that this is a position or identity characterized by confusion, and that bisexual identified folks should pick a real orientation, heterosexual or gay or lesbian. So. I need like a whole 2 minutes. And then could someone read the inclusiveness and acceptance on this page and those bullet points, and I come right back? Do I have a volunteer?
I'll read. Hopefully the TV is not too loud in the background. Hold on.
Just the voices.
Oh no.
Sorry, y'all. I just gotta step away.
Okay, I was gonna take over and read, but I kind of got a distraction. So we're gonna do inclusiveness and acceptance. Can you guys hear me?
Yes.
Yes.
Okay, so in our roles as sexual health promotion professionals or sex educators, it is important to foster an attitude of inclusiveness and acceptance of human beings, regardless of their sexual orientation. To do so may be helped by recognition that sexual orientation and identity are complex. People of all sexual orientations live, work, and play among us. Heterosexism and homophobia exist. Fear is based on ignorance, and everyone can have their own personal values about this issue, but it's important to not make anyone feel bad about who they are. These simple rules provide a solid framework for respecting the sexual orientation of everyone. Make them the bottom line in the forefront of your thinking, especially the last one. Everybody gets to feel how they want about this and have their beliefs. We have no deliberate intention to change people's attitudes and beliefs. Though it is not unusual for people to come to a new set of beliefs when presented with accurate information about sexuality topics, beliefs and values are individually inspired, not taught.
Perfect timing. Thank you, Rhonda.
Did you want me to read the last part or no?
Oh, there was one more section. Yes, read from, instead of our roles as educators, read from our responsibility.
Our first responsibility is to ensure that our language includes everyone. So we are deliberate to use language that recognizes some people are gay or lesbian, some are bisexual, and some heterosexual, and some asexual. As such, we often think about people's partners rather than making an assumption that they have a boyfriend, girlfriend, or husband, wife. We ask about someone's love life, not do they have a boy or girlfriend. Remind yourself not to assume all people are any particular sexual identity. Try to use examples in your sessions that are inclusive and language that can be interpreted as including everyone and being respectful of sexual diversity.
Now put the bear under the damn tree.
Thank you so much. And guess what? We're not too far off schedule. Is everybody ready to go to the exam? The quiz. It's not an exam, just a little quiz.
Yes.
All right.
Exams are scary.
Right? I'm like, just saying it is like, no, we're not doing an exam.
Having like college flashbacks.
Yes. Okay, number 1, sexual orientation plays an important role in determining how masculine or feminine an individual is. Is that true or false?
False.
Give me another pen.
False.
Thank you.
All right, false. All right, if you got a little more background other than answers, mute for me. Just so that those listening. It's okay, it's okay. We're all in this together. Don't worry about it. Heterosexism is described as having extreme feelings about the unacceptability of homosexuality. Is that true or false?
False.
False. Heterosexism is not. Okay. 3, about how many Americans identify as gay, lesbian, bisexual, or other non-heterosexual identities?
D.
About 5 to 7%. About 5 to 7% in these ways, though many more people have engaged in sexual activities with the same sex partners. Yeah. And the choices were what, 20%, 30 to 40%, or 1 to 2%, and the or the 5 to 7%. And it is the 5 to 7%. So biphobia refers to intolerance of and fears towards people perceived to be bisexual. True or false?
True.
Yes. Biphobia. 5, sexual orientation is often determined by, is it sexual behavior, feelings of attraction, biological sex, None of the above are correct. Orientation and
Maybe feelings
attraction.
of attraction.
Feelings and attraction?
Yes, feelings and attraction. So think of orientation as who you're attracted to. And that's a kind of a, you know, a way to try to remember what orientation, sexual orientation refers
So
to.
feelings of attraction is the right answer?
Yes, it is. Feelings of attraction. Okay, 6. The Ellen Show debuted one of the first kisses among a same-sex couple during a prime television. This resulted a great deal of media discussion and discomfort among many due to the quote-unquote heteronormative viewpoint that exists in the current culture, or the homonormative viewpoint that exists in the current culture, or the heterotic viewpoint, heteric viewpoint
Heterocentric.
that exists in the current culture, or the homoerotic viewpoint that exists in the current culture. It is the
Heteronormative.
Heteronormative.
Yes, heteronormative. And you have to go back to some of the chapters with the definitions that, you know, we didn't read through everything, but if you read through it, the answers are there. But heteronormative. Okay, 7. This term refers to who we have romantic and erotic feelings for. Sexual behaviors, sexual orientation, gender identity, or relationship status. You know this because this is the question in reverse.
Sexual orientation.
Right, so we did 5. Sexual orientation is determined by feelings of attraction. And then we're doing 7. The term refers to who we have romantic and erotic feelings for. Feelings and attraction is related to that sexual orientation. 8. Most Americans support same-sex marriage rights. True or false?
False.
We're gonna see. I believe that statistics say different.
Okay.
9. Example. So I selected true, but we're gonna check at the end. Okay. 9. Examples of this term include married or divorced, single or partnered, monogamous or polyamorous, sexual behaviors, sexual orientation, gender identity, or relationship status.
Relationship status.
Sexual orientation.
Orientation.
Sexual behavior.
With feelings of attraction.
Okay, you're right.
So we're gonna say relationship status because it can be all of those. 10. Sexual orientation is completely genetically determined, fixed and unchanged, an excellent predictor of sexual behavior, not necessarily a good predictor of sexual behavior.
D.
The
last one, yeah, because orientation, you're trying to go by who somebody's attracted to or who they have feelings for, but that does not give you a good guideline or barometer for what their sexual behaviors are. You cannot determine based on that. 11, gay people blank, or can finish the sentence. Gay people always wish they were the other gender. Gay people have gender identity consistent with other anatomical gender. Gay people often wish they were the other gender. Or gay people always behave like the other gender in childhood.
The second one?
Yes, it's the second one. Have gender identity consistent with their anatomical gender. Twelve, the Kinsey scale. We went over the Kinsey scale. It's based on the following: a dichotomous scale, a continuum, an agree-disagree questionnaire, or none of the above.
The scale.
Continuum.
A continuum. Yes, thank you. 13, which of the following is not a way to combat heterosexism and homophobia? So we went over that list of those bullet points, which is not a way to combat. Be non-judgmental, don't tease or harass others, don't talk about sexual diversity, don't out people.
Don't out.
Talk about sexual diversity.
Yeah. Thank you. I'm sorry, I'm not looking down to see who's answering, but great job, ladies. Our role as educators, as an educator, is to allow for a safe space for everyone, or ensure inclusive language, or not assume all people are heterosexual, or all of the above. All of the above, right? 15, last one. According to research, bisexuality is a denial or confusion about being homosexual, an indication that an individual always prefers to have many partners at the same time, is a transition from heterosexuality to homosexuality, or vice versa, or none of the above.
None of the.
None of the above. All right, let's go through. We got 1, false. That's correct. Number 2, false. That's correct. We have number 3 about the percentage, 5 to 7%. That is correct. 4, biphobia is true, correct. 5, feelings of attraction, correct. 6, the heteronormative viewpoint, correct. 7, sexual orientation, correct. 8, most Americans support the same-sex marriage rights. That is true. I would say nowadays, right? 9.
I'm surprised.
They probably just changed their answer because it's legal now in some places.
I was thinking the same thing. Is that really true?
It's so much harder.
Right. 9, relationship status. That is correct. 10, not necessarily a good predictor of sexual behavior. Correct. 11, gay people have gender identity consistent with their anatomical gender. Correct. 12, Kinsey scale is based on a continuum. Correct. 13, don't talk about sexual diversity is correct. 14, we have all of the above, correct. And 15, none of the above, correct. So we got 15 out of 15. And just so you all see, I took this exam for the first time with you all. I was running a little bit behind, so, but we did it together. That's the good part. Any questions before we get off here? We're not doing bad. We're doing about our consistent time, 8:45. Yay. I wish it was ending at 8:30, but that's not working out. Any questions?
No questions.
Not at the moment.
Well, I wanted to see all your beautiful faces. Do we have a good turnout tonight? Yes, I think so. I think so. I thank you all. You guys are like empowering me and making me accountable, because what if I fell off on chapter 7, you know? Now I can't. Y'all waiting on me, right?
We don't have class.
Yeah, so I appreciate you. And if you have any questions or concerns, let me know in our group chat. If you're not in the group chat, the messenger chat, you can always contact me privately or get in it. Just let us know what your preference is. I know we have 10 million Facebook pages and groups and messengers, so do what works for you, but I'm here and I'm available if you have any questions or concerns. But please, please, please go in, do your chapter quiz so that when we get to the end, we're all close to the same point. All right, hope you motivated and encouraged, and get you a sponsor on this this $39 social seller, the last one for the year. It might get you promoted or get you that what's the bonus called? Team builder bonus. Okay, I don't know what level you all are at, but read that compensation plan. It works out. And it's fun building a team. It was a little scary at first because I was just getting started, but I wasn't ready for people to be under me, but it's working out. So don't be afraid. Don't be afraid. The sisters will support you. All right.
Thank
Y'all have a
you.
great night. And
You
let's
too.
You too.
get
Thank
into
you.
EO if you can.
Hi, ladies.
All right. Bye-bye.
Right.